Explain what you're going to do and why it is necessary. Explaining the procedure and providing information to the client fosters trust and cooperation. Ma'am, I will assist you, but you may just stay in bed. However, this procedure would require you to take off your clothes if that's okay with you. Rest assured that I will be giving you the maximum privacy I can give you if it's okay. Now we perform hand hygiene if it's not yet done. This is to prevent contamination and possible transmission of microorganisms. Next is for client privacy. Make sure to keep the door shut and the curtains of the windows pulled down because hygiene is a personal matter and providing privacy is the client's basic right. By respecting this, the nurse can foster client's comfort and participation in the procedure. Next is to prepare the client and the environment. Ensure a comfortable room temperature. Room temperature must be moderated because air current increases loss of heat from the body by convection. Are you cold, ma'am? Do you want me to minimize the aircon? If you ever feel uncomfortable, just tell me, ma'am. Next is to offer a bed pad or urinal asked if he or she wishes to use the toilet or commode because warm water and activity can stimulate the need to void. The client will be more comfortable after voiding. Ma'am, singanan ka mangi before ta mag-start. Okay, ma'am. And then, encourage participation in self-care as possible. Encouraging the client promotes independence, exercise, and self-esteem. We also assess each area of the skin carefully. Skin must be assessed for any wound or irritation so the nurse can provide special care to the affected area. Now we position the client appropriately. This avoids insurancing and training and promotes good body mechanics. It also ensures client safety. Now place a bath blanket over the top sheet. Remove top sheet starting at the client's shoulder and moving down linen toward the client's feet. The bath blanket provides comfort, warmth, and privacy to the client while carrying out the procedure. Now we remove the client's gown while keeping the client covered with a bath blanket. Mom, please remove your shirt. I will help you. Removing the client's gown permits easier access when washing the client's upper body. Next is to fill wash basin 2/3 full. Test temperature of water because water at proper temperature provides warmth and relaxes the client. Water must be lukewarm because it will cool during the procedure. Now, we make a bath mitt with a washcloth because a bath mitt retains water and heat better than a cloth loosely held and prevents end of washcloth from dragging across the skin. And then we begin with washing the face first. We must begin the path at the clearest area and work downward toward the feet. Next is to place towel under the head. Now we wash eyes with water and dry them well. Magsabon ka ma'am or dili? Now we use a separate corner of the washcloth for each eye and work from inner to outer canthus. This prevents transmitting microorganisms from one eye to another. Wiping from the inner to the outer canthus prevents the secretions from entering the nasal cramp, entering from entering nasolacriminal tract. Now we proceed with washing the arms and hands. Place a towel lengthwise under the arm away from you to protect the bed from getting wet. Use long, firm strokes from wrist to shoulder, including the axillary area. This promotes circulation by increasing venous blood return. And then repeat the arm nearest you to complete washing both arms. Now we proceed with washing the chest and abdomen. First is to place the bath towel lengthwise over the chest, folding the back blanket down to the client's pubic area. Placing bath towel keeps the warm while preventing unnecessary exposure of the chest. After placing the bath towel, we now proceed with washing the chest and the abdomen. Now, we proceed with washing the client's back. Assist the client into a prone or side-lying position towards you. This permits easier access of her back for a more efficient washing of her back. Next is to place the back towel lengthwise alongside the back and buttocks to keep the client covered with a blanket because it provides warmth and prevents undue exposure. Now we proceed with washing and drying kinds of back from shoulders to the buttocks and upper thighs. This is to perform systematically and to avoid washing back and forth, which may cause contamination. Now we proceed with washing the legs and feet. Expose the leg for this farthest from you to easier access with washing. Fold the bath blanket toward the other leg, keeping the perineum rather covered, which promotes privacy and maintains the client's dignity. And then we place the bath towel and twice under the leg to prevent the bed from getting wet. Now wash, rinse, and dry using long, smooth, and firm strokes from ankle to thigh. Washing from the distal to proximal area promotes circulation by stimulating venous blood flow. Now we reverse the coverings and repeat for the other leg. We reverse the coverings to avoid contamination.
Wow, pinawang Gaston, oy. Sana all, Gaston. Palibang lang, dapat malibang. Mausag labay kay ako kay
Now we wash the feet in the basin of water. The feet must also be washed to ensure that all surfaces of the lower extremities are thoroughly clean. Dry each foot to prevent the client from feeling cold and reduces risk of contamination